Meanwhile, I've spent months trying to get answers from the state about your right to know important health information that could save your life, especially when it comes to epidemics like hepatitis A and now the coronavirus. But the health department continues to keep it all a secret. And after the governor and surgeon general tried to ease concerns about the coronavirus today, more questions were left unanswered.
There are still no cases of coronavirus in Florida.
Governor Ron DeSantis assuring the public today not to worry, but he was not transparent about any real information regarding how many Floridians have been tested for the disease.
So I don't think I'm allowed to kind of go into the numbers. I actually wanted to give all the numbers, but they pointed me to the regulation or the statute that said you can't list all the numbers.
But we looked into that statute, and many lawmakers say the state is misinterpreting the law, since there is exemptions that clearly state information should be made public only when necessary to public health.
It doesn't make any sense to me when the statute clearly says that if people could be at risk, then you should inform them, essentially. That's the essence of it.
Congressman Charlie CRIST also believes the state's lack of transparency seems to be more focused on protecting tourism than protecting the people of Florida.
It's troubling. I mean, if you're trying to protect an industry and you do so with a potentially lethal situation, how do you explain that? How do you justify that? Money over people? What's that about?
And even though we know the CDC tested 445 people in the U.S. for the coronavirus, we still don't know if any came from the Sunshine State. The governor wouldn't even say where possible cases are suspected and where patients are being monitored.
Please note that we're strictly respect the confidentiality of individuals who are either persons under investigation or those individuals who are under self-isolation having returned from China. That is what is required by Florida law.
And the Surgeon General defended his reasoning. The coronavirus has not risen to the level needed to release more information.
This is defined in statute. It has to be highly infectious of nature.
But when hepatitis A was highly infectious, even an epidemic in our state just a couple months ago, this Surgeon General still kept 80% of cases in food service workers a secret from you, the public.
I think that's part of their job, and I think they have an obligation to let us know what is going on in the communities.
And the Surgeon General had even less to say when I confronted him in Tallahassee at a recent hearing. Doctor, doesn't the public have the right to know? Dr. Rifkes, please, doesn't the public have a right to know? Meanwhile, several Democratic senators are now calling for a release of those testing stats to better protect the public. And if that doesn't happen, they're threatening to file legislation on Monday to change the law and get the information themselves.